They say third time is a lucky charm. So welcome. Welcome to the third episode of The White Spaces. I'm really excited about talking to our guest tonight. He claims he survived the crypto winter while building incredible health tech on distributed ledger. This and more in just a few seconds as we look at what's been happening in the tech space. The pre-IPO filings of Airbnb showed that the company burned through $1.2 billion in the first half of this year. Reason? Because of the COVID-19 pandemic, the company had to refund travelers as our world came to a standstill. From US, we're moving to the EU, Brussels to be specific. The European Commission came out with a direction for a new regulation that is set to regulate crypto assets by 2024. Not much is known as to what it's going to look like, how it will affect CBDCs and other up-and-coming technologies. One thing is certain though, the crypto and blockchain industry needs to have a united front in Brussels to lobby this initiative. And on this battle cry note, I want to welcome our guest tonight. He's a researcher, a digital health expert, and a psychologist. Please welcome Eberhard Szojers. Thank you for coming, Eberhard.
Thanks for inviting me.
Very nice having you here with us. And let's just kick things off. I want to talk to you about something that we just kind of shook hands with our elbows, the COVID-19, the big virus, the big pandemic. And I want to accent specifically the technological part in this. And surely there's a lot of research that's being carried out to help us counteract the virus, but from the technology/social media perspective, do you think we have overblown this virus, this pandemic, out of proportion? What's your opinion?
Well, first of all, I think COVID is still something that we don't know yet quite well. What we know is that it's more lethal than for the flu, although a lot of people debate that or say it's just like a normal flu. So I think from the medical point of view, it's not blown out of proportion. We knew that something like that would come at some point. So it's just the question how we handle it. I mean, it's not as lethal so that it's not extinct humanity. So how are we going to live with that? And we see how technology can actually help us to live with that. And the most prominent thing is that we could have done this interview remote, Zoom, but we choose to do it on site. So I think we slowly find our way around the pandemic and protect ourselves with masks, with the Ebola handshake, as people call it. So I think technology will also help us to cope with it, and especially remote sessions. You don't fly to conferences to China for just 48 hours anymore. Technology helps in that sense, and also from my background, from the medical field, we see that a lot of things that were not being made in the past, like remote counseling, although the technology was there, people were just not adapting it. But right now, just overnight, the pandemic caused everybody to adapt to it. All of a sudden, remote counselings by doctors were possible, and you have to know doctors are the most technical averse group of people, and healthcare in general is a very conservative area. So I'm glad to see that technical means that support better care for patients are finally adapted. Even we are forced to, but I don't think there will be, even if COVID would disappear, I don't think we would go back to the past.
The non-technological past, that's what you mean.
Well, technology was always part of healthcare. I mean, we have a lot of very high, MRIs, computer tomography. I mean, technology has been part of medicine all the way, but just like the normal interaction with patients hasn't changed a lot in the last 100 years.
Right. But I'm still curious to find out the following. So we've had SARS, we've had MERS, we've had those pandemics 10, 15 years ago.
Yes.
What we didn't have was social media, or at least not to that extent. We didn't have that, mass market technology, viral technologies that could potentially amplify something of significance, which obviously COVID-19 is, to a scale where we start to panic. And I wanted to poach your opinion on this specifically because you are a psychologist. So how do you see that development specifically?
Well, I think setting social media apart for a moment, with the past pandemics, we saw that SARS or MERS, they were much more lethal, but they were contained at an early stage, and they were not as infectious as COVID-19 is. So I think the truth or the facts always come back to us. I mean, even Donald Trump said he thought he would be immune, not wearing masks, but finally the virus got him. So there's no way of trespassing truth or science, but social media made it more obvious what's going to happen or what's happening around the world. I mean, the first reports of COVID were posted by this doctor in Wuhan to his colleagues, and they spread it through the Chinese platforms, which are as big or even bigger as the ones we are used to. So the word got around, and the party couldn't contain neither the virus nor the truth about it. So they had to face it. And I think with all the technology, social media, at some point, even there's a lot of fake news around politically motivated news being pushed into those media. I think most people still have a lot of common sense and have a clear judgment about what's going on. And even people try to influence opinions about social media. In the end, I think the truth cannot be hidden.
Thank you. Thanks so much. And I'm very happy that we're talking about the truth, because in addition to being a doctor, you're also a blockchain expert. And my question to you would be, how do these novel technologies like distributed ledger, like artificial intelligence, how do they help the medical and healthcare field, industry specifically? What is the necessary innovation that is happening with the use of those technologies?
Well, first of all, we still don't see a lot of adoption of blockchain technology in healthcare, although we work on that, trying to implement real cases using blockchain technology in the context of care or gathering patient data, but still the adoption is very slow. I mean, we need some COVID moment for blockchain that would probably help to boost it. But the core of your question focuses on how can, for example, distributed ledger technology, i.e. blockchain technology, help to maintain the truth. And I think especially blockchain technology is very suited for that, because once it's on the blockchain, you cannot change the information, you cannot hide it unless it's like a consortium blockchain. But if you're using public ledger technology, then of course everybody can access this information. And I will tell you one example where this is very important. It's clinical trials. In the past, we had the situation, or we still have the situation, that you can take out certain subjects, patients, records on the basis of missing data, or they didn't fit the criteria. But until now, this is sort of intransparent. And if you would record anything on blockchain, who's in there, what kind of criteria we're using, nobody can go back and change the reality. And I think this is something that we see, especially also in the healthcare area, that if you record things properly, that helps in the end to make better care, to have better clinical trials, and the results of the clinical trials should also help us to provide better care to patients.
You said something very interesting when we just started this discussion, and I want to pick on that a bit. You said it's a very conservative industry. What's your estimate how digitalized the medical and healthcare space is in percentage? Are we 20% in, 30, 40, 50, 90?
Well, I think if you look back into February, the numbers are much different. I mean, especially if you would ask somebody, have you counseled a patient via the internet, or i.e. Video conference? In February, no doctor, or very few doctors, would have told you, yes, I did. My wife is a nutritionist, and she started overnight, she started to counsel patients via Zoom, FaceTime, you call it. So, I mean, it also shows that not for every medical problem it's necessary to come in to the doctor's office. We see that Switzerland, for example, has been ahead of rest of Europe, adapting technology, especially in the telemedicine area. Switzerland has been, compared to the rest of Europe, way ahead for many years. Now the rest of Europe is catching up. But those were very specific areas of innovation back then, before the pandemic. And right now, I think, as I told earlier, that we will not go back to the times before the pandemic. So we're still we're used to do Zoom. And in the industry, you have to consider people only move if, and this is why we call it an industry, if they can make money out of it. I mean, compensation is a very big driver in the industries. For example, many years digital health was not paid. Apps that make you feel better, that make you lead a healthier life were not paid by the insurances. So a lot of startups that I worked with, they came to a point, I had an innovation, I have a product, and then they couldn't get the insurances to subsidize it. So innovation was cut short because the startups couldn't survive. And the same thing is if the telemedical treatment is paid at the same rate as on-site treatment, counseling, then doctors, nurses will take it up. And I think, and that's why healthcare is so conservative. The reimbursement structures of healthcare are very conservative. So in order to come into that cycle of reimbursement, you have to prove that your innovation is actually working. You have to do clinical studies. And very often they are way too expensive and take too long for startups to really enter that space. And what we see now is that not startups are basically reshaping the healthcare systems around the world. These are the big IT companies that try to reshape healthcare around the world.
Yeah, that's very interesting. And I want to move forward with this remuneration topic. There's a very big debate happening right now in terms of who should own their data. Also, the next question from my side is, so who should own medical data of a patient? And is it possible to monetize that?
Well, first of all, I'm a strong believer that data that has been harvested or generated on my body, my behavior, about my health, belong to me. And that doctors, hospitals, insurances can only use the data if I give them permission. Right? Very often right now data is being taken from me, and I say deliberately taken from me without my consent. And slowly in the last couple of years we have the discussion. So everybody's using the data, monetizing the data, and the whole AI field of algorithm building needs a lot of data. They live on that. And very often they take big data sets, and it's kind of dubious where they come from. And I personally think this is wrong if somebody monetizes data without asking me for permission, and even one step further, not sharing the profit with me.
So what would be the solution?
Well, I think this was also the start, the same question that you're just asking me, why we 3 years ago started with our foundation using blockchain technology exactly for patient-controlled data. And I think this is the future, that patient data is not centralized in one big data bank, because once it's there, I totally lose control of what's going to happen with that data. And I think if data is sort of decentralized and I'm always the gatekeeper to my own data, then this is a whole different game, because they always have to ask me case by case if they are allowed to use my data.
Okay. And then, assuming that you would allow that, you could also get reimbursed.
Yeah, if we take the reimbursement process, how it's executed right now, I mean, especially around treatments in healthcare with the health insurances, this is very, it's not a lean process. It takes time, always takes people to have a look at it. And I think if you combine that blockchain technology, patient-controlled data, you also have the possibility of executing digital contracts associated with that, exchange data for payment, and nobody really has to look into it if you automate it. For example, I take the insurance example. If an insurance does a campaign about losing weight, then they say, okay, if you lose 10% of your weight, then you get a 10% rebate or discount on your premium. So the way it would work is that, okay, you agree to that, both sides agree to that digital contract, and then somebody has to take your weight at the beginning and then function as an oracle and say, okay, Pavel has lost 10% of his body weight now, and he's eligible for that 10% discount, and it could be executed automatically because it's already in the digital contract that both sides agree on that, And on top of that, you can even introduce digital currency, i.e. cryptocurrencies, that says that Pavel not just only gets 10% discount in his healthcare insurance, he also gets 100 Swiss francs as a bonus, and that's being paid in Ether, Bitcoin, or any token that's tradable.
I think Hilsana tried to do something like this to incentivize you to do different things. So they had an app very similar to that. Like, you need to go out and you need to take a picture of yourself running, and then you'd get points, and then you could kind of redeem them and then do all sorts of different things. And I had that, and I logged in, and after a while, all my points were gone. So that was a bit of a bummer, but yeah.
Well, I think not only the health insurance you just mentioned does that, a lot of other health insurances do the same thing. But we know from the voucher system that a lot of vouchers are not redeemed, so it's actually a good business for whoever gives out vouchers, that half of the people will never redeem what they're eligible for. But I've been told by one other insurance that they were very surprised when they started this program, that people were actually willing to do a lot of things for very little payment. I mean, 10,000 steps per day is hard to reach unless you jog every day or walk a lot. And the maximum that they could earn in that program per year was the counter value of 120 Swiss francs. And so they said, we never thought that people in Switzerland, where people earn a lot, would be doing that for that little incentive. And that shows that apart from the sheer monetary value that you can gain, there's kind of the gamification aspect to it. Then if I look at my Apple Watch, and my wife gave that to me to lose 10% maybe. So in the beginning I thought I don't need that, but now I mean, it's a constant, okay, did I reach my daily goal? And so.
Yeah, so that is working. I think there's also a very interesting example, and I think it was in Moscow Metro, where you had to do 30 squats and then the machine would give you a free ticket.
Okay.
So that's also a way, kind of gamification, people, keeping people a tiny little bit healthier, happier. I don't know.
In general, I think incentives work. Otherwise, we wouldn't do what we're doing in Centiva Health and HIT Foundation. And that infiltrates every aspect of our life. I mean, being a trained psychologist, I know incentives work much better than punishment. So I remember there was this one campaign in Italy, I think, in Rome, I think it was in Rome, that if you collected an X number of PET bottles, then you got a free ticket. And they never had so much recycling going on in Rome than during that time.
A free ticket to go see somebody, or free car park tickets?
For the public transportation.
Really? Okay,
Yeah.
wow, impressive. Yeah. And you need to incentivize people, otherwise, yeah. Carrots work better than sticks, in any case. Yeah.
For most people.
For most people. That's a good one. I wanted to ask you, how much do you know about Estonia's, where I'm from, the e-health initiative?
I've met some protagonists of that, and I know sort of how it works.
Okay, because they claim, and I hope it's true because it is on a distributed ledger, that I think 99% of medical data is digitized, and 100% of patient data is also digitized, and it's all accessible. And rumor has it that they've used distributed ledger before it was cool, before it was called blockchain. So I just wanted to see how much you know about this, and whether or not Estonia is the model for other countries when it comes to digital health.
Well, in general, I think that the degree of digitizing data in the public context is way ahead of other countries. That's not only true for healthcare, it's also the e-government stuff, voting online. I think Estonia is way ahead of other countries still to date. If it comes to healthcare, what I know about it is that yes, health data is digitized. Everything, if you go to the hospital, then it's an electronic medical record that the data is being entered into. And there are other countries like Israel where you can actually, across hospitals, across the whole country, access the digital record. The way digital distributed ledger technology is used, as I understand it, it's a company called GuardTime, who is the partner of the government in implementing that for many years. And it's only like the access or the granting access through the patient is why you use blockchain. I mean, you would never put patient data or any larger data sets on blockchain because blockchain is just not made for that. It doesn't make sense to have hundreds or 50 copies or 1,000 copies of the same data distributed around the world. So in that sense, it doesn't make sense to put data on blockchain, especially health data where you have a lot of data if it comes to imaging data like X-rays or MRIs. But they use blockchain technology where they, you have an identity and you can give access also for a limited period of time to another player on that platform to your data that's being stored off-chain. And I think this is the way forward, that you control the access, but the data must be even secured by blockchain off-chain because it's just too big.
Yeah, it's too big of a data set.
Yeah.
If we look at the past 10 years, what would be your top 3 healthcare innovations and why?
I think apart from the digital innovation, we have gene editing. I mean, we can address diseases that have been out of reach for treatment before. We have incredible progress in the treatment of cancer. But since I'm from the digital health area, you certainly would expect me to say something about digital innovation in healthcare. And it's kind of very difficult to point the finger at some innovation. I think being able to interact with patients remotely, although that has been done in 1872 by the first telemedicine treatment over the phone, and the doctor diagnosed the cough as croup, so he decided on that he didn't have to take his carriage to visit the patient. He just told the mother what to do. But still, I think remote telemedicine is an innovation that comes to my mind. Apps that were not being able to be administered to patients before, because apps, they kind of have autonomy built in. So they have some sort of intelligence built in, especially if they give you recommendations what to do. And that can simply be go to sleep or practice more because you're too fat, something like that. But we see more and more much more advanced apps that take a lot of data, and based on an algorithm, they recommend something to you. And we also see early detection apps. I mean, platforms, you give your symptoms and they make a recommendation what to do. Something that in the past you went to the doctor, the most expensive resource in the healthcare system, you used his or her time, can be done now via an algorithm. And a lot of people would say, this is not the healthcare that I want, but I still think that freeing the very expensive resources in healthcare, because not every country has as many doctors per capita as Switzerland or Germany has. So wherever the medical expertise is a scarce resource, apps, algorithms, artificial intelligence, you want to call it, helps. And I think this is probably the entry of artificial intelligence into healthcare, one of the major achievements in the last decade.
Thank you for that. I want to cherry pick amongst all of those incredible things on the gene editing, CRISPR specifically, and I want to get your opinion whether it's good, bad, and when can we start actually designing our own babies?
Well, CRISPR-Cas9, when it was published as a method, I mean, people saw a lot of potential, what it can do. And I mentioned this already, that treatment of certain diseases is now possible. That was not before we had that tool. The honeymoon kind of is over. We see that it's, in some cases, it's not as accurate as you think it would work. And then the ethical aspect comes to it, because the enthusiasm is that I can treat something that I couldn't treat before. But we see with what happened in China with the one doctor designing babies. I mean, he was not designing babies, he was basically taking a certain disease snippet out of the genome. And when it comes to applying gene editing in humans, I still think we need a discussion in society if we're worth to pay the price. For one, it's a very expensive treatment, so we have to discuss, can everybody access that treatment? I mean, Donald Trump said that everybody will get the Regeneron treatment that he got for free. And it's so expensive that you have to ask, so why would he not grant access to general medical care, which is much more cheaper than what he just said that everybody could have for free? So that just doesn't work out. I mean, we have to have a serious discussion about all the treatments, including CRISPR-Cas9, that we have. Are we willing to pay for that on the financial side? Because our healthcare systems get expensive every year. You pay every year more insurance premium. And on the other side is, do we want the consequences of that everybody is healthy? And in the end, I mean, we all know that those Silicon Valley billionaires putting a lot of money into eternal life research. So in the end, if everybody can have good healthcare and can live forever, what does it mean for us? I mean, reproduction would be a no-go because the planet just can't live with 60 billion people on it. So, I mean, every advance in science needs a consensus in the society how we are going to use it. And unfortunately, currently, we see a lot of societies around the world that cannot come to a consensus what they want. If we see US, if we see Brexit, I mean, those societies are totally divided on issues that probably are much less important than do I want this treatment for my child or my parents, and if they get it, somebody else doesn't get it. So, difficult question that I cannot answer. Everybody has to answer that for him or herself, I think.
Yeah, I think it's a complicated web of different parameters that I think time will tell. And just to close things off, my last question to you is, I've picked up on your Twitter feed that you were on a train to the World Economic Forum and you've met Greta Thunberg and you talked, apparently, and you would want to talk to her again at some point and meet her again. And I'm curious to find out, what did you talk about?
No, actually, I didn't talk to her because I didn't know that she was on the train. So the funny thing was that our CTO and I, we wanted to go to Davos, and we wanted to meet at the Zurich main station to go together to Davos, and then the train left and I called him, "Where are you?" And he said, "I'm in the upper level of the train." And I knew at that time I was in trouble because my train only had one level, so I was on the wrong train to Milano, so I had to leave the train in Zug, go back to Zurich, wait for the next train, and apparently in that train was also Greta Thunberg, which I didn't know at that time. I only saw her leaving the train in Davos, and every single journalist was standing at the train station, and they were certainly not waiting for me, they were waiting for her. And when I got out, everybody left and ran to where she left the train. But I think I would love to talk to her the next time I'm in the same train.
What would you ask her?
What I would ask her is what she would tell my sons, one of them being the same age of her, what they could do in order to get that much energy and determination to save the world, because I think she started with her cardboard and nothing else but an idea, and it just hit a nerve with a lot of not established politicians, but with the youth that we as parents always thought they are not interested in anything, they're only interested in Netflix, their Instagram profile, but boom, we saw that they are interested in much more, and I think for a lot of established politicians that was a wake-up call, because young people are our future, we are the present, and very soon, at least, I will be past. So,
well, not that soon. Let's hope.
No, we never know.
We never know. Yeah. Thank you so much, Eberhard. This was very insightful, and I'd like to invite you to move on to our future trend prediction, and we need to move just over here. So, welcome to our ghetto board. It's still the same, just like in the previous episode. So let's focus on what we're going to do over here. So as we just discussed off camera, future predictions 2035, and we're looking at different verticals: social, technological, economical, environmental, political, legal, and ethical. So make a prediction, choose one, choose all of them. The floor is yours.
Okay, if we take technology and personal freedom right now in the context of COVID-19, for example, it can be used to show that I was tested negatively, that I have a certain number of antibodies, and that I'm free to access certain points, be it a retirement home, a certain holiday area, travel to a certain island. Then technology can be used for maintaining personal freedom, and if that's today or in 2035, I think it will be the same. But on the other hand, it can also be used against you. I mean, if you're tested positive, you're not allowed to exert that personal freedom. And I think if we take that example, how technology can restrict your personal freedom, then we will have a glimpse into the future. Because I remember being in China 10 years ago, you already had those cameras in public spaces, but you still thought you can freely move around and not being tracked anywhere. But now, is it China, Hong Kong, is it London? You have those massive numbers of cameras in the public spaces, and you can be tracked. I'm not saying that everybody tracks me when I go to the train station now, but if for some reason I stick out and they want to trace your and my tracks, it's possible with the technology, because everything relies on data, and the more data we gather, then your personal freedom can be restricted. 10, 15 years ago, I mean, if you did something in a computer system, you probably got away, nobody was complaining, but because at that time, human beings had to control what you're doing. Nowadays, you have programs, smart programs, artificial intelligence that does that massive work for you. So there's no way of escaping that. If you leave a data trail, you can be tracked, and that can be used to affect your personal freedom. We take the social credit score in China. This is something you get a certain number of points, and if you don't behave properly, if you pay your rent late, if you walk across a red light, points get deducted from your score. And we never know if that very effective method for behavioral change cannot be implemented here also. And then data technology very much also goes into the economic aspect. I mean, our economies rely on the data. The better you are educated, the more you can use that new technology, the more you advance in society, also in your payment. I mean, we have those who cannot take part in that economy because they're just not educated enough anymore. And so I think personal freedom, if you want to use it wisely, you should educate yourself so you can stay ahead in the society and be part of that society and make an impact in on that society for the greater good of us all. And that then we come to the last point, that's the environment. And I think apart from COVID-19, which we consider right now as the biggest challenge, especially in terms of economic growth or the lack of the economic growth, I think once the pandemic can be handled through vaccines or treatments, we come back to the most pressing issue that we're having, which is the environment. Global warming hasn't gone away. I mean, it took a pause because people were not traveling that much, but this will come back to haunt us, and I think this is the greatest challenge for our survival on this planet until the end of 2035.
Yeah, Greta should be nearing her 40s by then, so hopefully a lot of activism would have been done on her watch. But in any case, thank you so much, Eberhard. Thank you so much for coming. Let's do the Ebola handshake again. You were a wonderful guest.
Thank you.
Yeah, thanks again.
Thank you. That you shouldn't focus too much on what you want to do if you want to start a company, rather than solving the problems of other people, because then you will be successful.
Are there any books that you would recommend yourself reading?
Well, first of all, I wrote a book myself, and then it was a novel, and then the publisher got bankrupt, so you cannot read it anymore. But I would recommend 3 books that I just read recently. The one is Where the Crawdads Sing. I think it's a brilliant story about survival. The other one is The Trick, which is about illegitimate son of a Jewish rabbi who, when he was old, meets a young boy, and then the story of his past, how he escaped the Nazis with a trick because he was a magician, evolved, and I think this is very interesting. And the last one is, which was really an enlightening moment for me, was the ascent of money. So, and being a psychologist, I never cared so much about money, but the concept of money really was what got me in that book, that money is not for eternity, it's just something that everybody agreed on, and that we, if we don't agree on it, it's worth nothing.
Thank you for tuning in. I hope you're going to read those books that Eberhard has recommended. And I am still blown away by the conversation we had. What an incredible human being. And on this note, I want to thank you for tuning in one more time. And I also want to thank my incredible partner, Oleg Velk from our media, who is behind the camera. Unfortunately, you cannot see him. I will bring him out at some point, I promise. And I also want to thank Sexy BTC, our publishers, who have been so helpful and so supportive throughout this process. So thank you all, and most importantly, thank you, our audiences, for tuning in, supporting us. This has been our 3rd episode. Signing off. Thank you so much, and you stay classy, ecosystem.